Hi, my name is Christine Thompson, and the proposal that I chose is to bring awareness to a cancer called primary peritoneal cancer. Primary peritoneal cancer is a cancer of the lining of the organs inside the abdomen called the peritoneum. It's a rare cancer, and it's usually found at either stages 3 or 4, and it affects primarily women. It is similar to ovarian cancer, but even women who have had hysterectomies can get primary peritoneal cancer. The signs and symptoms are vague, so women can get abdominal pain and indigestion and a loss of appetite, and then abdominal bloating. The bloating is usually caused from a fluid in the abdomen called ascites. Some women can get shortness of breath from what's called a pleural effusion, which is the fluid around the lungs. Primary peritoneal cancer is usually diagnosed the same way ovarian cancer is diagnosed, and it's sometimes mistaken for ovarian cancer. So they do a blood test called a CA-125, sometimes an ultrasound, MRI, or CAT scan. The paracentesis of the fluid in the abdomen, the ascites, or the fluid around the lungs can be done. PET scans can also be done, and that will show the different spots of cancer. And then surgery is sometimes done to determine if it is ovarian cancer or if it is indeed the primary peritoneal cancer. The risk factors, like I said, it mainly affects women, and usually of women of advanced age, so usually over 60. Obesity is a factor, as well as family history. Women who have had children after the age of 35 or have never had children are at an increased risk. And then hormones play another factor. So people who were on birth control are at a lower risk, but women who have used estrogen therapy after menopause are at a higher risk. And of course, family history is also a risk factor. Primary peritoneal cancer has no cure. It is also treated like ovarian cancer with chemotherapy. They can use IV, but they can also use the intraperitoneal chemotherapy with the primary peritoneal cancer. The same chemotherapy that is used for ovarian cancer is also used for primary peritoneal cancer, and the doctor that I talked to said that they usually don't like to use the same chemotherapy twice because it loses its effect. It's not as effective because the cancer kind of adjusts to it. The reason I chose primary peritoneal cancer is my mom was diagnosed in 2015 when she was having some shortness of breath with walking. She had a pleural effusion, which they drained with paracentesis, and then they tested the cells, which showed that she had the primary peritoneal cancer. She went through rounds of chemo. She then had surgery to try to get as much of the cancer out as they could. They couldn't get it all. Some people they can, but with her, she had some on her bowel, so they couldn't get it all. So then she went through more chemo, and she eventually went through all the chemos that they have, which are not many. Since it's not a well-known cancer, it's not as looked into as much, so they don't have a bunch of different chemos for it. So she had PET scans after each chemos to see how the cancer was doing. So since she has exhausted all her chemo options, now she is on a breast cancer hormone treatment called letrozole. And she's doing fine on the letrozole, but she will be on chemo the rest of her life. So that's why I wanted to raise awareness, because when she was first diagnosed, even being in the medical field, I had never heard of primary peritoneal cancer. Doing the research for this project, I could find very little. It was always lumped in with the ovarian and fallopian tube cancer. I did find out that it affects 2,000 to 10,000 women in the United States each year. Um, it also has a 5-year survival rate, um, the 5-year survival rate is 29% if it has spread to other areas, and usually 60% of the time it has spread. So I think awareness needs to be brought to the primary peritoneal cancer. Um, there's many people, many women whose lives are affected. So I did make a little infographic with um, how many women it affects, and that's aggressive cancer with few warning signs. I did find a um, support group called Martha C. Knonem Primary Peritoneal Cancer Foundation, and they had personal stories, and you could possibly talk with somebody who has the cancer. So I just wanted to say um, the primary peritoneal cancer is similar to ovarian cancer. It's rare. Usually, if it goes to the cancer goes to the peritoneum, it's from somewhere else. And then, like I said, there's minimal support groups out there for um, people with this cancer. So thank you for taking the time to listen to my proposal and to spread awareness for primary peritoneal cancer.